Welcome back, crime fighters. It is time for another edition of Calhoun County's Most Wanted, the program where you get to help make Calhoun County a better and safer place by helping this guy, our sheriff, lock up the bad guys. Calhoun County Sheriff Matthew Wade, good to see you, Sheriff.
Hey, it's always good to be on the show. You know, I see a little hair on my face.
Look a little fuzzy.
Little fuzzy, you know, and if you see a deputy sheriff running around and they got a beard growing, just know that you know, No Shave November is coming up. It's still October, but I let them start a month early because they are paying $25 a month to have that beard. Along with our turkey fry we do at Thanksgiving, we get donations, and we support two charities. One is the UCP, the other is the Alabama Baptist Children's Home. And at Thanksgiving, we hope to give them a really big check. I mean, $4,000 or $5,000 hopefully, or more, where they can take that money and go buy Christmas presents for those foster kids in those homes. And you know, it's hard to buy for your family. Could you imagine being a nonprofit and having 15 or 20 kids you're trying to buy Christmas for, how expensive that would be? Yeah. So that's where our heart is. So when you see that deputy with a beard, go, just understand they're doing it to help. Yeah,
it's also nice on that aspect of being able to have those gifts specifically taken care of so that you can take this other money that's been donated for the general expenses and keep that on those expenses.
Absolutely.
And it doesn't cut into the services you're able to provide.
You know, one thing I heard at Leon Smith's funeral, I heard something that Leon, the new mayor, Alton Craft, was talking about a thing that Mayor Smith said. He said, you know, we should take care of the elderly because they deserve it. We should take care of the children because they're our future, and that's where we're at with that. So.
Absolutely. All right, so let's talk about what our viewers have done here in the last week.
Another good week. Got 2 arrests. You've never let us down. Brings our count up to 4,050 people put in jail, all because we worked as a team. Thank you for the teamwork, and we can't do it without you.
All right, one quick event that we want to mention to you coming up on Saturday. It's Drug Take Back Day. A lot of folks have got prescription drugs in their home that they had a valid reason for having them. They no longer need them. They need to get rid of them so that people don't break into their house and steal them, or so that kids don't get into the closet and accidentally get them. We need to get rid of those, and there's an opportunity.
Absolutely. We're going to have the drug take back. We have the box at our office. You can come in our office anytime during the week and put it in that box. We really encourage people not to pour those out into the commode. It gets into our drinking water. That's bad. Don't do that. So, you know, this is a good thing. You don't want to leave it laying around. A lot of people who have a drug problem, a substance abuse problem, will steal from their family drug cabinet. My mother, like everybody else's mother, they keep everything. So it's not good to leave that medicine in there if you don't need it anymore.
All right, so like the sheriff said, you can take it down to the sheriff's office any weekday, but you can also go this Saturday to the Walgreens on Quintard Avenue, and they're having a drug take back day there hosted by the Agency for Substance Abuse Prevention, and that'll be on this Saturday from 11 until 2. All right, we need to take a quick break. When we come back, we're going to get started with this week's crime fighting on Calhoun County's Most Wanted.
And welcome to this week's edition of Calhoun County's Most Wanted. First up in our lineup this week, we still have Remington Johnson, last known to be living in Birmingham. He's wanted for that triple murder in Rabbit Town. He's still at large. Somebody knows where he is and what he's doing. We need to hear from you. And this is Clayton Brown. Mr. Brown, last known to be living in Jacksonville. He's wanted for failure to appear on a burglary 3 x. And meet Laura Chaplin. Ms. Chaplin, last known to be living in Oxford. She's wanted for failure to appear on theft of property 1st. Take a look at Charles Taylor. Mr. Taylor, last known to be living in Jacksonville. He's wanted for failure to appear on forgery 2nd. And we'd like to have you take a look at Eric Talley. Mr. Talley, last known to be living in Anniston. He's wanted for failure to appear on criminal trespass 2nd. And this is Theodis Given. Mr. Given, last known to be living in Linden, Alabama. He's wanted for a probation violation on theft of property 1st. And last up for the first half of our lineup, Nathaniel Davis. Mr. Davis, last known to be living in Piedmont. He's wanted on a probation violation for child abuse. That's it for the first half of our lineup. Stay tuned for the second half later in the show.
All right, we'll have some more bad guys for you to help us find here in just a few minutes. But right now, Sheriff, we want to welcome a good doctor onto the program, Dr. Rodney Sneed.
Hey, he's been
Good to see you.
yes, sir. It's been in the emergency room. Took
Thank
care
you,
of
Chris.
many a people.
Yeah, he's taking care of me and my family as well,
Yeah,
so thank you for that.
Well, we enjoy that. That's a privilege. So,
The reason that you're on here today, though, is not to talk about my personal family situation and our health, fortunately, because you'd be telling me I need to lose weight, and I don't need that again. But you're on the show today because things are happening in the medical world that are affecting all of us, and it really is. Everybody watching this show has been impacted by the changes in the medical world, whether they've been sick or not, just because of the financial way things are working out and how it's reshaping the medical industry. It has really taken a major shift in the last 25, 30 years, hasn't it?
it has. It has. I think our medical care system is not as efficient as it could be, and it's not as patient-centered as it could be, and it's led to a lot of frustration, both on the part of physicians and the patients.
Yeah, one thing that I've noticed is that we've gone from having the small family practices where the doctor would own the practice. It seems like those are disappearing, and it seems to me from the outside, tell me if I'm wrong, but it seems to me that a lot of that is happening not because the doctors want to change that, but because they just can't handle all of the paperwork and red tape that they're required to deal with these days.
I think that's true. It's very true. If you look at a lot of physician practices, you see them either going bankrupt or selling their practices to larger organizations who have the technical capability of keeping up with all the technical requirements. But that creates its own inefficiencies in and of itself.
Yeah.
So,
I want a doctor who is focused, laser focused on what's making me sick and what can make me better, not a doctor that's thinking about all kinds of red tape and whether or not they've filled out the right thing, and it's just gotten too confusing, hasn't it?
well, it has for me, at least, and for many physicians, I think. We went to medical school to be able to focus on the patient and take care of their problem. We didn't really go to medical school to be a data entry technician, and that's part of our frustration.
And sure, it happens in all walks of life. I know you do a lot more administrating than you ever thought you would when you got into law enforcement.
Absolutely, you got to be, your English skills have to be more attuned when you're in law enforcement. When you got in law enforcement, I didn't know I had to write all of these things that I have to write. So we understand.
And it's true in every profession, but it's not the same in every profession as it is in the medical profession today, is it?
No, it's not. I think things have changed, and I don't think it's any one particular organization or person's fault. I think that's just the way things have evolved. But I think there's some better solutions. I've been studying some things for the last 4 or 5 years in a national movement called direct primary care that I think addresses at least some or a lot of those frustrations.
So if I understand direct primary care, it basically means that, okay, we're going to take at least a part of our health care away from the current system with the insurance companies and such, and invest in a direct relationship with our physician. Is that right?
To some extent. Now, insurance is needed by all means for major portions, but I've heard the analogy used, would you use insurance to cover the tires on your car? No, you just go out and buy tires. You don't need to file claims and submit refiles and do coding and all the other things that an insurance office, physician's office has to do in order to buy something that is basic and simple.
All right. So this would change the relationship with insurance and such, but it certainly wouldn't eliminate it. If we get cancer, for example, we're going to need to have that insurance.
No, everyone needs insurance
Right.
for major
in case
problems.
that kind of thing happens. Yeah.
For
If I had
catastrophic
COVID,
events.
If I just didn't feel well because I might have a fever, then that's a whole different issue, I would imagine.
Yeah.
And the question I guess I have is, can we have that relationship? I know that there's so many things that have been legislated and changed, and if you don't have a certain amount of insurance coverage that qualifies, you get a tax burden and all this kind of thing going on. So is this something that this relationship that can be changed right now, in healthcare today? Or?
It is changing, and changing fairly rapidly. The Affordable Care Act mentions specifically direct primary care medical homes in the Affordable Care Act, saying that that is an alternative, what they're called an alternative payment model that is approved and encouraged. And Tom Price, before his departure, had encouraged that type thing. Of course, we know Tom Price was a physician, so he was knowledgeable of both aspects of it. The reason they do that is that the direct primary care tends to improve health by a number of different means. It lowers cost in several different ways and increases the patient satisfaction. So I think it accomplishes a lot of things.
All right, we need to take a quick break, but we want to talk some more about this in just a few minutes. I know, Sheriff, healthcare is something that is very much on your mind as you try to tackle the healthcare bills of all the folks that you were responsible for in the Calhoun County Jail.
Absolutely.
It's a big deal for individuals, for families, and for organizations.
And those are tax dollars being spent, so we need to try to do it and protect those tax dollars the best we can while providing the health care that's needed.
All right, so we're going to talk more about this in just a moment when we come back on Calhoun County's Most Wanted.
And welcome to the second half of our lineup. First up this half, Wilbert Dodd. Mr. Dodd, last known to be living in Wellington. He's wanted for failure to appear on domestic violence by strangulation. And meet Darius Savage. Mr. Savage, last known to be living in Birmingham. He's wanted for probation violation on theft of property second. And take a look at Charles Bowling. Mr. Bowling, last known to be living in Ohatchee. He's wanted for probation revocation on distribution of a controlled substance. And we'd like you to meet Paris Marshall. Mr. Marshall, last known to be living in Gadsden. He's wanted on a probation violation for robbery first. And here is Anthony Rivera Rosario. Mr. Rivera Rosario, last known to be living in Anniston. He's wanted for bond revocations on manufacture of a controlled substance and obstruction of justice using a false ID. And last up in our lineup this week, Brittany Carden. Miss Carden, last known to be living in Anniston. She's wanted for probation revocation on possession of a controlled substance, use and possession of drug paraphernalia, and obstruction of justice by using a false ID. And that's it for our lineup this week. If you know the whereabouts of these folks, please give us a call at Crime Stoppers. That number 256-238-1414.
More Crime Stopping coming up in just a few minutes. We're going to have the Crime Stoppers segment of the show. We'll talk about some unsolved property crimes in the area. Maybe you can give us a little piece of information to help solve those crimes. And we'll have our Crazy Criminal of the Week coming up shortly as well. But Dr. Rodney Sneed is with us right now talking about direct
Primary care.
Direct primary care. Okay, didn't want to say it wrong. Basically changing the relationship of the patient and the doctor, getting back really to closer to what it used to be back in the day, where for minor things like a cold or allergy issues or whatever, we may just pay directly for our care, or we have a monthly payment that we pay to the doctor's office instead of to our insurance company, and then we still keep the insurance for the catastrophic care, just have a higher deductible so we don't have to pay them as much. Spend part of what we save directly with the doctor's office and changes the whole dynamic.
Yeah, and then the difference between that direct primary care fee and what you save by using high deductible can be used for gap coverage, for specialty care, coverage of medicines, put into a health savings account under some circumstances, or any number of other things. So
what you're talking about here, it not only changes the flow of the money, obviously that's part of it. Money's going to be a big part of anything like this. But it also changes the interaction between the doctor and the patient, doesn't it?
Well, that's the main goal. That is the big thing, because what it does, it removes so much of the doctor's overhead that he has time to spend usually 45 minutes to an hour with each patient as opposed to the 10-minute visits. And during that 45 minutes, he is not distracted by having to enter unnecessary data. Now, don't get me wrong, a lot of data is useful, but I think that there's some things that we do that are not really helpful for the patients. And it puts the physician's focus back on the patient. What that does is, one, it provides more patient satisfaction, but it also, if I'm able to listen to you intently for 30 or 40 minutes, sooner or later I'm going to figure out what's wrong with you. So it eliminates a lot of unnecessary testing, a lot of, and during that same time frame, I can spend a little time educating you on healthcare in terms of what to do, what not to do, so that you're better able to take care of yourself and better able to prevent illnesses. There was a county government in North Carolina, Union County, North Carolina, that entered into this type of model with around 1,900 patients of their employees. They offered this option to all their employees. And what they found was that they spent, I think, around $1.7 million less through their own insurance company, but also the patients themselves saved about $300,000. And at the same time, the patients reported much more satisfaction and they felt like their health was better. So I think it's a win-win for everybody. It's even a win for the insurance companies because the overall health care costs go down. There's not as many hospitalizations, not as many emergency department visits, and all those other things like that.
All right. Now, the downside of this, I guess, though, Sheriff, if you're in the doctor's office now and he's got 45 minutes, you're not going to be able to lie about things. He's going to get the truth out of you.
Yeah,
We're going to come to an understanding.
there you go. But, you know, it's very interesting. That's an interesting model. So.
Well, I think it is. I'm very excited about that concept.
So what's the reality of it in Calhoun County today? Is this just something that we're talking about that could potentially help people down the road, or is this something that can help people now?
There is no offices in Calhoun County. There is an office that does this in Fort Payne, Alabama, another one in Rainsville, Alabama, and I will mention that it has many similarities to what people call concierge medicine, and I bristle a little bit at that phrase because it sounds elitist to me, but direct primary care is for all spectrum of patients. It's from the very, very sick to the very, very healthy that don't want to spend time waiting in a doctor's office waiting room, and from those very underinsured to multimillionaires who just provide like a better type of care for themselves.
All right. I guess the number one key on this is going to be to make sure that people actually engage their gray matter, think about it, and make sure that that if they're making this change, that they've researched who they're going to be working with.
Right. Now we will eventually in our office be launching another physician into that model direct primary care. Dr. Lucy Morris is a primary care physician who is moving back to Anniston, originally from Anniston, and she's very interested in that model. So we're going to sponsor her in that role.
All right, so it's coming locally?
Yes.
All right, so this is something that people can start looking at now and deciding if it's right for them, and I think it's going to be a growing wave across the country.
Yes, I would study it. I wouldn't make any sudden moves, but I think if you begin to study it now and learn a little bit about it, you'll find that it's, for many people, it's a much better care model, especially for large corporations who can provide choices in their insurance plans. One can get a high deductible for those, or for those who buy their own insurance can purchase high deductible policies.
Well, very educational, Doctor.
Okay.
Glad you came on the show today.
All right, thank you.
Good to see you.
Appreciate it.
All right.
Yes, sir.
Thank you.
All right, so we will take another break. When we come back, we will have the Crime Stopper segment of the show and our Crazy Criminal of the Week on Calhoun County's Most Wanted.
And welcome to the Crime Stoppers portion of our show, where we ask you to give our investigators some help on the following cases. First up, on October 11th, a home on Pettus Road was burglarized. Now, nothing was reported taken at this time, so if you have any information, let us know. Also on October 14th, a home on Rhodey Turner Drive was burglarized. 2 bottles of medication were stolen from that location. And on October 16th, a backpack was taken from a vehicle parked at a residence on Nunnally Lake Road in Ohatchee. And sometime on October 18th, a coin-operated air machine was stolen from a business on Chakalaka Road. And sometime on October 17th, or between October 17th and October 18th, a red Yamaha Rhino was stolen from a barn located on Old Downing Mill Road. And between October 18th and October 19th, this home on the 8,000 block of U.S. Highway 431 in Alexandria was broken into. And sometime between October 20th and October 21st, a breaking and entering of a vehicle occurred at this residence at Alexandria-Jacksonville Highway. And on October 27th, October 22nd, the tailgate was stolen off of this Ford F-350 while it was parked at a residence on Raptor Way in Anniston. And last up on your caseload this week, on October 19th, the storage building at a residence on Pine Ridge Road in Wellington was burglarized. They got away with fishing rod, pieces of medieval-style armor, and collectible toy soldiers. And that's it for the Crime Stoppers portion of our show. If you know any information about these cases, and we hope you do, please give us a call at Crime Stoppers. That number, 256-238-1414. Remember, we want your information and not your name.
Stupid! You're so stupid!
All right, it's time for our Crazy Criminal of the Week. Sheriff, you ever drive around and a good song comes on the radio and you start singing in your car?
Man, every day.
You ever get a fine for it, or ever give somebody else a fine for doing that?
I don't think I've ever done that.
25-year-old man in Montreal, Canada, got pulled over, got a $118 ticket because he was singing in his car.
Was it a good song, or was he bad singer?
It was CNC Music Factory. Everybody dance now, you know?
Yeah.
Gonna make you sweat. Yeah, it's got that line where they just scream out, "Everybody dance now."
Yeah.
Well, apparently he leaned out his window and screamed that.
To the cop?
No, just out to the general, population, and somebody reported that he was, screaming in public. I don't understand how it works in Canada, but they pulled him over a few minutes later, and the police officer asked if he'd been screaming out of his car. He said, "I was singing." They gave him a $118 ticket.
Man, that's messed up right there. That's the reason why people don't like cops. Whatever.
So is it safe in Calhoun County for people to drive around and sing the CNC Music Factory?
As long as you're not doing anything that would endanger anybody else, it's perfectly fine. If you're singing and you're swerving in out of both lanes or doing something dangerous, that's one thing, but it ain't got nothing to do with singing. So
I do know a few people, myself included, who probably should be fined for their singing.
yeah, keep your windows up. We'd appreciate that maybe so we can't hear you.
That does help. There you go. That's the defining difference. Keep the windows up so nobody else can hear you, except my kids who can't do anything in the back seat. All right, that's all the time that we have for this week. We'll be looking for you again next week, but hopefully not in the lineup on Calhoun County's Most Wanted.